students, before discussing the clinical case, just to go through the MCQ and put the right answer in the comment box. I appreciate and acknowledge your answer. Miles operation is A, B, C, D. Put the right answer. Now, before going to the second MCQ, request all students to subscribe my YouTube channel, share with your friends and colleagues, press the bell, and you can learn surgery on day-to-day basis with either lectures or spotters or MCQs about images, operative procedure, clinical cases, and illustrations. So please subscribe my YouTube channel. Second MCQ is ultimaire electrosymptom is done for A, B, C, D. Put the right answer again. I appreciate your answer. So what this finding is, look at that. This is a grooved proctoscope. It is a grooved proctoscope. All of you know that proctoscopy. All of you know that it's a grooved proctoscope. We can see that there is a proliferative irregular lesion. Surface is bleeding. See that just above the dentate line is here. This is the dentate line. There is a proliferative lesion here. See that? So that is the lesion in a grooved proctoscope. You can see properly. So it is probably polyp or most likely to be a carcinoma. Carcinoma lower most rectum, just above the dentate line. Now, important thing is, common presentation is it bleeds like a piles, bleeding for rectum, per annum, and they think it is piles. So unless you do rectal exam, you will miss it. Remember, 90% of the carcinoma rectum is identified through rectal examination. Again, same thing holds good. 90% of the carcinoma rectum may be missed if you don't do rectal examination. Rectal examination makes very crucial in any bleeding piles. It's very essential. And once you do that, it's very low. See that, take a biopsy, confirm, and if it is coming down inguinal lymph node, maybe examine whether involved or not. If skin component is involved, inguinal lymph node maybe not, otherwise not. Otherwise proximal node, rectal nodes and high up. Liver secondaries may be there. So you have to do CT abdomen and MRI pelvis to assess the local area and take a biopsy and confirm. Usually it is adenocarcinoma, and CEA has to be done. And this is very close. You may not be able to salvage the sphincter here. So patient requires abdominoperineal resection, APR. So treatment is APR and permanent end colostomy in the left iliac fossa through the descending colon. So abdominal resection with the permanent end colostomy, then of course chemotherapy and radiotherapy. Rectum is always adjuvant therapy. Radiotherapy is useful for rectal carcinoma, not colon, but rectal adenocarcinoma, radiotherapy is useful. So adjuvant radiotherapy, then chemotherapy, then follow up with the CEA and CT scan, clinical examination, PET CT maybe. And if it is locally think that it is extensive, then you can give initial neoadjuvant radiotherapy plus or minus chemotherapy, then go ahead with the IPR, then further adjuvant therapy continue, chemotherapy. So that is exactly management policy. It's a very low, remember, you can't do any salvage, anterior resection, low anterior resection is very difficult to do so, because basic requirement for any malignancy is oncological clearance. You can't compromise oncological clearance and save the tissues. So clearance is the most important to attain a cure, achieve cure actually. So this is all things are there: CEA, LFT, MRI, CCT, abdomen, chest, maybe PET CT, permanent colostomy, RT, chemotherapy. See that? Rectal adenocarcinoma, radiotherapy is useful. Otherwise, most of the areas adenocarcinomas, radiotherapy is not useful because not that radio sensitive. Carcinoma rectum, adenocarcinoma rectum, and adenocarcinoma in the parotid, radiotherapy is given. All other adenocarcinomas, mainly adjuvant therapy is a chemotherapy. Even neoadjuvant is chemotherapy, remember. And so this is what carcinoma rectum. Please go through my manual of surgery. Every detail is there. It's a main question for you. Viva they will ask, MCQ, a lot of MCQ questions will come. So every detail is there in the manual of surgery. How to do rectal examination in detail with the video is there, my clinical methods in surgery. So there is a rectal examination, digital rectal examination is very, very important to diagnose carcinoma rectum. That is the most important point I want to stress to you all students, remember. So quotation of the day is, being simple and egoless make us more powerful and stable. So simple and egoless, that is very difficult, but the most important thing to be in how you be in the public. And students, again I request you to join my YouTube channel, subscribe, share with your friends and colleagues, press the bell, and learn surgery on day-to-day basis, images, x-rays, MCQs and spotters, and once in a while brief lectures, and once in 2 weeks live sessions where students will present a case, 1.5 hour discussion with me and senior faculties, and you get a certificate if you join session, which will be very useful and very interactive. You will learn a lot with that. Please join, subscribe my YouTube channel, and also have my SRB's Manual of Surgery is the best selling surgery book and covers everything as per CBMS syllabus: general surgery, thyroid, breast, varicose vein, arterial disease, gastrointestinal surgery, urology, neurosurgery, cardiothoracic, instruments, operative surgery, anesthesia, adjuvant therapy, with the footnotes, beautiful footnotes, management, lot of photos, illustrations, the investigation, treatment concept, tables, charts, and each chapter has got an online link where it gives a lot of MCQs, which is useful for your competitive exam like NEET. So the best book actually, manual book. Please have book, learn surgery well. My clinical method in surgery, mainly clinical examination, general surgery, general examination to all topics: thyroid, breast, arterial disease, swelling, ulcer, venous disease, then abdomen examination, rectal examination, specialty examination, briefly orthopedic, with the instrument and specimens, and with the differential in each chapter, but no treatment, no investigation, no management, but video in each chapter, QR code where suppose hernia or thyroid, you get how to examine thyroid with that. So it is like a lot of photos, and methodically how to examine it is given with all photos. So it will be best clinical method book for you to learn how to examine a patient. So clinical examination of a patient is the pillar in the learning surgery, analytically and thinking process. This is most important to learn surgery. And have my DigiNow lectures through JP Publisher, 220 hours lectures, covers everything including examination A to Z as for CBM syllabus. For 1 year if you purchase, you can learn surgery. So DigiNow lectures, manual, clinical methods book. You will learn surgery entirely without any difficulty. So, and also join my YouTube channel, so you can learn surgery perfectly, including to face NEET exam also. So please again students, I request you to join, subscribe my YouTube channel, share with your friends. So students, I hope you understood this lecture very well. Thank you so much.